Now, when it comes to medication interactions, and you'll see this on any website, you'll see this everywhere, they talk about, oh, it interacts with this enzyme in your liver called CYP450. So let me just explain real briefly how we got to that conclusion that it interacts with that enzyme. So there was a trial done in 2014. GW Pharmaceuticals looked at their product, which they have a prescription CBD low-level THC spray. And they noticed that, hey, they prescribed the spray, and then they did a test with a drug that speeds up the activity of CYP450 liver enzyme and one that slows it down. And I'll tell you exactly what the study said, because it's important to understand this to an exact, because it's in defense of CBD and really how minimal the chances of these reactions are. So they did a systematic review in 2014, and they concluded that CBD generally has a low risk of clinically significant drug interactions. A few studies in current review included examination of drug interactions with CBD, specifically GW Pharmaceuticals and their CBD THC spray. They used a CP450 inducer, a CP450 inhibitor, and this is what they concluded overall, that CBD in combination with these drugs are well tolerated, but consideration should be noted when co-administration with other drugs using this pathway is given. So they basically concluded this. In most cases, it's going to be safe, even when we're using drugs that would be considered to have severe interactions. Now, someone else brought up a great point actually earlier in the week on our forums, and they said, well, wait a second, what about taking it sublingually versus orally? Is sublingual going to have as much interaction as, say, a capsule or a food or an edible? And it turns out that was a fantastic question. No, when you take something orally, that supplement, that medication, whatever it is, it has to go through your lower GI tract, and then it goes right to your liver, where that metabolism of that supplement or drug occurs. When you take it sublingually under the tongue, like our droppers, it goes directly into your bloodstream. It doesn't go from your gut to your liver. It goes directly into circulation. And then once it's already been in circulation and been absorbed, some of the leftovers will then pass through the liver. So yeah, the chances are much less likely of having an issue with a sublingual than if you were to have, a mega dose of an oral serving or an edible or something along those lines. So I thought that was important to know. Another thing that's important to understand too is, these medication interactions appear to be so minimal, and most of them are done on CBD isolate. There's a lot of literature out there arguing that when you're taking a full spectrum product like we have, the terpenes in it, all these other components in the cannabis plant actually seem to work synergistically with a lot of medications as compared to working against them. So I think it's important to know too, most of the things studied when it comes to these interactions are on CBD isolates, not on full spectrum products. And the interaction of full spectrum is hypothesized to be even less. The only ones where I really, and this is again how we run stuff in my office, where we really have a concern is if someone's going through chemotherapy, I mean, they should just watch everything they're putting in their body. Again, there's a lot of people using CBD in conjunction with chemotherapy. Roswell Cancer Centers right here in Buffalo is starting to do a lot with it because of the benefits. So most of the time, probably not an issue. You just want to make your oncologist aware. Hey, listen, this is what's going on. Most of them are on board and willing to have that conversation. Seizure medications, same type of deal. You'd want to make your physician aware. Those are really the big ones. And then there's been some stuff saying the anti-anxiety medications, benzodiazepines. It's also important to note this. Where they're seeing the interactions, we're talking a serving size or a dosage well in excess of 100 milligrams a day. Mostly everything that you're seeing, if you're somewhere between 5 and let's say 40, 50 milligrams a day, extremely unlikely. So just some things are for people to understand. The current literature out there is based on pharmaceutical drugs that are mostly isolates. And again, like I said, the interactions are probably minimal at the most.